This conference will now be recorded.
And when you're speaking, state your name. Normally, when we were meeting in person, we used to have public comments. But for right now, we ask that you submit the comments ahead of the meeting time, submit it electronically. And as far as I know, we do not have any new public comments, so we can skip the to the next agenda on the meeting. Excuse me. But before we go on to that, I'd like to just make a quick pitch to the members that we do need a couple more members. Especially to, I don't want to say replace Barbara, because I think that has to be done officially. And as far as I know, she has not made the request to be removed from PHAB committee. So she's still part of this group. But I do think that because she hasn't attended the meeting, I want to say in over a year at least, that we probably need to do something a little bit more active in order to have that voice in this group. And I think especially with the upcoming work that we're doing, her voice is very important. And so I want to make sure that we do get, I want to make sure that we do have all the members that are in our PHAB membership as filled as much as possible. And I know that Les, you had somebody that you had thought would be good, and I'll forward you the link that Samantha had sent me so that she can make the application to that. If you just happen to be, on the cuff and somebody's asking, they can always go to Whatcom County Health Department PHAB website, and there's a list of vacancies that we have. And then when you click onto that, you can also have direct link to the application. You can apply directly online, electronically that way as well. Okay, so that's that. And Samantha, do we have Steve or?
I see Leah has joined us now.
Okay, perfect. So then, oh yeah, there's Leah. Leah, can you turn your camera on so we can see your beautiful face?
It's so early.
I know. yes, it is. Okay. So then
I can have my camera on. Leah can too.
Greg, you have a beautiful face as well. Okay, so I'm going to call roll just so that we have documentation that all the members that we have are here for quorum. I believe Steve Bennett, I don't see Steve Bennett. He's not here, at least yet. Barry Buchanan, I believe, had let us know that he was not going to make the meeting today. Sterling Chick.
Present.
Here, okay. Lindsay Karras. Hi, Lindsay.
Here.
Hi, Lindsay's here. Les Seeley.
Here.
Hi, Les. Leah Wayman.
Here.
Okay, perfect. So the next item on the list is the debrief of joint meeting.
Steve is here.
Steve. Oh, hi, Steve. Can you turn your camera on so we can see your beautiful face too? Steve have little kids, so he may have children running all over around him right now. But anyway, so Steve is here also. So everyone except Barbara is here. Okay. So the next item is debrief of joint meeting and health board meeting. Oh, actually, before we do that, let's just go ahead and approve the minutes from September and October. So the last meeting we had was September 3rd, and can I have a motion to pass?
I won't find it.
I motion to pass.
Okay.
A second.
Second, okay. Any discussion? Okay. Sterling?
Yes.
Steve?
I
Steve?
think he's lost. He had to get off again. He's having trouble.
Okay. Lindsay?
Yes.
Okay. Les?
Yes.
Leah?
Yes.
Okay, and I also say yes. So it passes unanimously. Oh no, can we pass it without Steve? Yes, we have quorum. Okay, so we're gonna pass unanimously. And the second meeting that we had in October was a special meeting, just because we had kind of full agenda on September. I couldn't finish all the things that we needed to discuss. So we had the second meeting in October, September 22nd. So can I have a motion?
I move that we pass those meetings.
Okay, thank you. How about?
And I'll second.
Okay, perfect. Sterling.
Yes.
Lindsay,
Yes.
Les,
Yes.
Leah.
Yes.
Okay, and I also say yes, so that also passes unanimously. Okay, so on to next item, debriefing of the joint and the health board meeting. I'm going to hand it over to Sterling to lead the discussion.
So we had a joint meeting where we combined two regular health board meeting and then our yearly meeting where we put together and Les, I'm hearing a lot of feedback from you, I think. And then we get, thank you. And so it was a unique thing. We had to, so we had that, the meeting where we met as a joint group, and we, the idea is that we meet to kind of get a common sense of what we're working on. We did some introductions and we talked about what each of us were passionate about in public health. And then Barry and Dr. Stone and Erica Lautenbach led a review of the roles and responsibilities of PHAB, because we have some new health board members and new health department members, new PHAB members. And then I hosted a short discussion of how we model and encourage civil dialogue around challenging health conversations. Those were, those were the kind of the highlights. And I thought the meeting went really well. Does anybody have any other observations that they had about the joint meeting separate from the health board meeting? Okay, so then we had our regular health board meeting, a special health board meeting, where we introduced two items. We introduced an ordinance creating the Whatcom County Child and Family Wellbeing Task Force. Which was passed by the health board. Is everybody hearing me? I think I've lost.
No, we can hear you.
Okay, okay. I'm reading from the form. And I couldn't hear any feedback, so I was okay. Go ahead. That's great. So we, which was passed by the health board. The health board passed a Child and Family Action Plan in February, and so things have been slowed down because of COVID and all that. So the idea was that we created an ordinance that created this task force. It had timeline and a combination of permanent and designated or appointed members. The county council asked or decided that they would look at the additional appointed members, because that's the ones that are appointed by the by the county council. And so they had a couple of meetings where they added to the members who were to be considered. They were mostly focused on adding, making sure that there was a representative from the faith community, that the school representative also could include someone from a private school or home school, and they wanted 3 community members who had experience caring for children, as a parent, as a foster parent, as a grandparent, or as a guardian. They changed the term of office for appointed members from 2 years to 4 years. They set the number of additional appointed members to 15 rather than having a range, and they had to up to 2 members and up to 5 members depending on which category there was. And so now we're at a point where that's been approved, I guess. Astrid, what are the next steps for the task force?
Thank you. Astrid Newell, for the record, Astrid Newell, Community Health Manager. The amendments or the edits that were made by the committees have now been incorporated into that draft ordinance. It still needs to go through the process to get it into the hopper for official approval by the council. And so it looks like, because of dates and timing, that it'll be the 24th of November that it will be on the agenda for the council meeting. So just for timing. So we're working on the paperwork and the behind the scenes, but it's basically will be ready to go for that final approval.
And then what happens after it's approved? What are the steps? I mean, how do they get these members, and how do they actually get it to start, and all those kind of technical details?
In the past, with other task forces, it has been up to the staff of departments to help manage the recruitment process, and there can be some decisions about how to select. Certain of 15 of the members are appointed members, so there's a recruitment process to ask those entities to do to select their members, and then an application process for the others needs to be set up. So those are a couple of immediate tasks.
And so that takes a little time. And does it seem reasonable that sometime in January or February there would be real movement on the creating of the task force?
I think so. I think that's would certainly be the aim, to get that rolling.
Great. Does anybody have any questions about it, where that's at right now?
I do. When the draft was originally created, the number that we put in there was 10 to 15, put a range in there, so that we will have, but there will be flexibility in whether there are 10 people available to appoint or 15 people. My concern is that 15 people, that's a kind of a big number. So if we don't have 15, is it a no-go? Is the wording in that document, in that section, specific to bounding, or is there still room for latitude to make sure that if we have less than 15, we can still move forward with the task force?
There shouldn't be any issue there. Just as with any board, like our board, we have vacancies. So, or the Public Health Advisory Board, there's vacancies. So it would be vacant positions. So a continued recruitment for those positions. There is a little, the language about up to is potentially a little challenging to, when you read it, suggest that we are going to limit the number of people from underrepresented communities, and so I don't know in terms of interpretation of the language that was added if I think I understand what they were getting, what the council was getting at, but it's also a little challenging when you read it. There's community members from underrepresented communities up to 5 members, and so potentially we could have 15 members from underrepresented communities, and when that would be potentially valuable. So anyway, it's just a little bit of interpretation of some of the language. But.
Is there any way to just point that out to the council when they're looking at this as kind of like a suggestion, or that they?
It was in Carol Frazie's committee, so perhaps we can. I can certainly reach out to Carol and just have her read through it again. I suspect there could be an opportunity to amend that language a little bit, but I don't know if it's 100% necessary, but I just want to make sure that it's not interpreted in that there's not unintentional consequences of the way it's worded.
Right.
Well, I was listening to the meeting, and if I'm not mistaken, that language was put in that way to give flexibility as to who can be on the task force. So I think it may be just really up to the interpretation. So
yeah,
in a way, the appointing the process is probably more important than the wording, because they were really trying to make it so that there's room.
Right. Yeah.
And it'll be a fair bit of work for the council to get that spread that they're looking for of different members. They've given themselves a task. Hope they're up for it. Any other questions about that part? Because I'm going to talk about the racism thing next. So the second item, yes? Oh, okay.
Will we know when recruitment begins for those members of the group, of the task force?
Yes.
And will that please start the process before it gets through council again, or everything just really has to start as after it goes through council?
We could certainly, as staff, work on the application process, and actually it'd be really helpful to have PHAB advice and recommendations around because the application process can include questions or that we're trying to solicit to gauge interest. Obviously, particularly for those appointed positions, it would go through council, so they would have the opportunity to look through applications as well, or look at that. But if the folks are interested, if there's a couple people that are interested in helping think through that application process, that would be amazing.
Yes, that would be awesome. That was what I was getting at, especially if we want to get up and running as soon as possible after it's passed. I think having everything in queue for what we can would be ideal.
Astrid, would you like to hear, would you like to get names of PHAB members who might want to help in that process?
Sure.
Okay, Leah?
And it has to be, I think it has to be a small number, just because of the quorum issues and.
Oh, no, absolutely. Leah, are you interested in helping Astrid do that?
I can. I think other people have been involved, so I would defer to let them have been more involved in this task force than I have. And if they are interested, then for sure, I would let them, just so that we can keep it small. But otherwise, yeah, you can put me down.
And
Lindsay,
I
how about you?
volunteered to be part of that, so.
Lindsay, how about you? Do you want to help as well? No, we could only have 2, right? To make sure that we don't have quorum. Okay, Lindsay, do you want to help as well? I mean, I'm sorry, I don't mean to put you on the spot to say yay or nay.
That's okay.
So just like Leah said, I think for those, if there's interest from those who have been more intimately involved with the Child and Family Task Force, then I would definitely have them go before me, just because they have more background knowledge. If we're needing people, I would love to help.
I
That's fine. Yeah.
I guess my point of that was people who have been involved are in the process of already involved. And I would love perspective from other people just to help with the questionnaire. I think fresh new ideas and new set of eyes are always a good thing. Okay, so Sterling, you want to go on to the next topic?
Yeah, sure. The second item was about recognizing historical and ongoing impacts of racism on public health, and the resolution to pass to declare racism a public health crisis. Dr. Steve Bennett outlined the history of racism and the current struggles of people of color as they continue to experience health disparities that begin even before birth. And so that led to a rousing discussion and a decision on the county council to edit. No, I don't know what the right word is. Not edit, but to look at the resolution and try. The attempt was, it seemed like, as the council was talking, that they wanted to pass this unanimously rather than having it be something that had a 4-3 or a 5-2 vote. And so it was decided that there would be a small subcommittee of 2 PHAB members and 2 county council members that would get together and write or look over the resolution and make some changes in an effort to have it be something that all 7 county council members would feel comfortable passing. And I understand that Ben Allenbass and Rudd Brown and from the county council, and Leah and Steve from PHAB are about to have a meeting with the county and go over the ordinance and see what they can do. And is that correct?
Yeah, we have edits from Ben, and so we will have a meeting on the 13th to figure out a path forward. I don't know how much more detail other than that. There's some work to do. It's apparent that we're coming from 2 different places. And so I think that there's some talk that will need to happen and some cooperation that will need to occur.
And I very much appreciate you and Stephen and Leah. I don't know if did we volunteer? Did you volunteer, or were you kind of like, I can't remember how it happened, but I really appreciate your willingness to take on this. It's not an enviable task that can become very political, and I hope, I really want this to work.
I just want to make sure that you guys feel supported in this. And the second thing is, after you guys have worked on the document under the subcommittee, I do ask that you guys bring it back to PHAB, and then we take a final look at it before we kind of send it off to the council. And I think we discussed that last time, but I just want to make sure that that's re-emphasized.
Yeah, can I add one thing? Can we make sure that council knows that we're doing that? Because I just want to make sure we're communicating with them as far as the scheduling and for us, because my guess is we're going to have a special meeting of PHAB in order to look at that, to get it back to council on time for them to be able to do anything with it.
Samantha, you can correct me if I'm wrong, but I think if it's just one document, you can send it to all of us through Samantha. And then as long as we communicate back to Samantha, I think we don't necessarily need to meet and go through the document, you know, at a special time, because I'm just thinking about the time aspect of it. And if we can all look at it individually and give feedback back to Samantha, then, you know, then you guys can see it and you know, and then go back to the council. Unless you think we need to meet, then you know, then I think we need to have another special meeting. But
I guess maybe then we would know after the 13th if we feel that we need to get PHAB to actually vote to approve it.
Yeah.
And we're
So
looking at,
just-
are we looking at
Oh, I'm
potentially getting this in front of the health board on the early December? Is that a reasonable expectation?
So I just want to clarify process. The PHAB has already passed this document off to the health board, so technically it lives in the health board now. So there isn't going to be a back and forth where the PHAB will then reapprove another draft, because it's already been passed off to the health board. So this is
Okay.
This is an opportunity for the two of you, Leah and Steve, to work with the health board on refining what is now their document. So so we would certainly pass what they've agreed upon along to all of you, but it's not really a debate point within the PHAB at this point. That makes sense.
That makes sense. Thank you.
yep, thanks for the clarification, Erica. Makes it easier.
And just to clarify the timeline of this, it does seem that the next opportunity for the council, if it was the health board, would be to that early December health board meeting. I've forgotten the exact date, and then that would be, is that a reasonable expectation, do you think, for Steve or Leah, that we'll be able to knock this off in one meeting?
I literally can't tell you. I don't know.
Do we have an hour? Is it an hour long?
It's 2 hours long, and we do have a facilitator working with us as well to help keep the discussion moving. And we also have a meeting to kind of talk about how we want it to flow and where we want to make sure that we're reaching agreement, what the most key points are. So.
Thank you all for that. Yeah. And I think that any other comments, I think I'm done with my part of this meeting.
I'm curious. The county council, as Sterling said, wants, Les Seeley, by the way, for the record, seems to want to pass it unanimously, and I'm hearing that it might be hard to do that. Is there a way to force the county to vote on it without an unanimous agreement? Can we get them on the record? Is that possible?
That would be at the discretion of the chair of the council if he
that's
to move forward, knowing that there isn't a unanimous.
Is that Barry or Rudd?
It's Barry.
Is that Barry? Okay.
Okay. Before we go on to the number 4th item, I made a mistake when we were passing the minutes. The first meeting that we needed to pass that we did was September 22nd, and Samantha pointed out the second one that we passed wasn't the September 22nd again, but the second meeting minute that we needed to pass was October 12th. That's on page 8. So can I have a motion to pass that meeting? I'm sorry.
Just to clarify real quick, that's actually the 3rd set of meeting minutes. We do have 3 sets to approve this meeting.
Okay, now I'm confused. Okay, so I see the September 22nd, and I see the October 12th. And so what's the 3rd one, Samantha?
The
The
September
September
3rd.
3rd. Yeah. So if you look at
Okay,
page
so
2
I was right.
is
Yeah. Okay.
sure.
So that is the third one, October 12th. So we did have 3 meetings that we needed to approve. Thanks for that clarification, Samantha. So can I have a motion to pass the October 12th special meeting, and that is on page 8.
I move to approve the October 12th.
Thank you. Do I have a second?
Second.
Any discussions? Okay. All right then. Sterling, how do you vote?
Yes.
Okay. Les,
Yes.
Lindsay,
Yes.
Leah,
Yes.
Steve? Steve, if you can't, if you lost the mic again, then can you just put it in the chat box, whether it's a yes or a no? Okay, I think we lost him again. Okay, so that passes unanimously with Steve's vote not being able to be heard, and I also vote yes. Okay, so let's go into the next item. Number 4, building on community health assessment and community health improvement plan and focus on racial equity. And Amy, is Amy here? Amy Reddell. Okay. Hi, Amy.
Good morning. I'm
I'm
Amy
good.
Rydell. I'm the health planning specialist at the health department. And I have to give a shout out and thank you to Astrid, who put together a lovely PowerPoint for us today. And I am wondering if I'm supposed to share my screen so you all have that, or will you be looking at that? Or do I just speak off of it? Do you guys have a preference? I think you're muted, Astrid.
We could, do you want me to run through it, or is it easier for you to, it's probably easier for people to look at it on the screen?
I don't know if Samantha is the presenter, she could do it and I'm happy to talk through it. Or she can make me the presenter and I'm happy to share my screen.
Amy, you're an organizer, so I think you could just try sharing your screen.
There we go. Perfect. Okay. There we go. All right. So, all right. Sorry, it takes a moment to see if things are mirroring, and then now I can't see any of you, unfortunately, when I share my screen. So please use the chat box, and then I will turn it off as quickly as possible so I'll be able to see your faces again if you have a question and things come up. So I just want to start by thanking you all for having me here today to give the update on the community health improvement process. And I also just want to thank you for all of the work that you've been doing this spring and summer and into the fall. I've been paying very close attention to the work on the Children and Family Action Plan and Task Force and the Racism Resolution, and I'm just very thankful and appreciative of your leadership and all of the work that you're doing. So thank you very much. As a staff person, it makes it really much easier to know how to step in place into spaces and community, knowing what sort of the leadership behind us is also in support of. So that's going to bring me to talking a bit about community health improvement. Right now, I'm just going to spend a little bit of time with just providing a brief overview of sort of what community health improvement is, where we're at in the process, some of the challenges and opportunities that have arisen, and then also just leave time for your questions and feedback. Hopefully you'll be able to see that all right. I know it's a little bit light on the screen, but this is just the cycle of community health improvement. And just to refresh ourselves, the typical cycle takes usually about 5 years to go through. And we are currently right sort of rounding the curve from phase 4, choosing effective policies and programs, into acting on what's important. This whole process sort of began in 2017, where we evaluated the first cycle of community health improvement to see what had been working well, how things were going. In 2018, we established a Healthy Whatcom team made up of community partners across Whatcom County. And we also started our community health assessment. And many of you have that document. If you don't have a copy of our community health assessment, it's available on the Healthy Whatcom website, which is just healthywhatcom.org, as well as the health department website. And during that phase, we really dig into the health and well-being of Whatcom County. The Healthy Whatcom team put a big priority kind of early on in looking at the disparities and inequities that we were seeing around our community and really shining a spotlight on those so that we could understand how health and well-being were playing out differently for different populations. In 2019, we held a data carousel where we put data up and spent a day digging into data with our community partners to identify our top community priorities. And many of you were there, and thank you for that. Through that process, we identified housing and homelessness, specifically for children and families, youth mental health, childcare as it relates to economic security, and then the overarching theme that really emerged was really this attention to racial equity and how we were seeing different experiences of health depending on race and ethnicities across our county. So that emerged, and then we moved into 2020, early 2020, and what we decided that was that there was so much really amazing work happening in all of the, in so many different community groups. There was, in all of these areas, there was already a great deal of work happening. And so as a team, we sat back and really paused at this phase and said, okay, so what is it that we need to do that's different? And at that point, I think, gosh, I started with the health department in 2015, and I think, God, probably within my first couple months, Astrid and I started talking about results-based accountability, and it's something that she has been really championing and interested in for quite some time. And we started digging into that as a framework, and it's a strategic planning framework where community partners are able to go through a guided and facilitated planning process that doesn't start with what is it that we want to do. It starts with where do we want to go? What's the data that we're looking at? What's the curve that we want to turn? And then your strategies kind of flow from that. And built into it is this layer of accountability and knowing who is responsible for what, who is doing what, and how the work is coming together and aligning. So to that end, we invited Clear Impact to come and do some learning with our community and spend 2 days in January hosting a results-based accountability 101 workshop where we had about 80 partners in the room, and we all got together and learned about results-based accountability and what is this framework and how do we use it. And we were offering these workshops in a series of sort of 3 workshops. That was the first one, learning the framework. The second one was inviting the Racial Equity Institute to come and spend 2 days with our team, with the same participants, really doing some deep learning about systemic racism and systems of oppression and how that is playing into our community fabric. And we really intentionally put that in the middle of this 3 workshop series so that before we launched into our strategic planning, we were having just a very deep attention to really understanding our both responsibility and power in helping to undo those systems of oppression. And so we had our results-based accountability 101, the Racial Equity Institute came, and not 2 days later, work was paused and COVID hit our community. And that was in February, the very end of February 2020. And we had to really pause the work as all of our staff were really pulled into different areas. And we have been slowly relaunching and getting back together with our group, with the Healthy Whatcom team, pulling back together. And we're starting to relaunch that work. And I'm going to just share, these are the themes that we had, which the only one that I didn't mention earlier was is that children and families continues to be a priority and commitment out of this work. And so then just going into the current status, as I was saying, the Healthy Whatcom team is starting to sort of relaunch our work, and which has been, a very interesting and lovely process. I think that in some ways, I those of you who know me know that I'm kind of an eternal optimist, and which is, never mind. I was going to make a comment about status of things right now, but I'm not going to. I am an eternal optimist, and so I look back and think about, in some ways, the gifts that pausing after the Racial Equity Institute came into our community to do that learning before jumping right into strategic planning. And so much has happened as a nation that has really readied our community to think about our health priorities in different ways, and really using a racial equity lens with a very intentional focus. And so that has really emerged as the largest priority out of sort of all of our work, is this focus on racial equity, and realizing that of the 3 priorities that emerged with youth mental health, childcare, and housing and homelessness, the disparities and inequities that we're seeing, those are all symptoms of the lack of racial equity within our community. So as a group, we're really trying to figure out how to now relaunch into our action planning, because the 3rd workshop we were not able to hold, and that was going to be the workshop where we were going to develop our community health improvement plan and our action plans. So as many of you know, that we are holding, in partnership with the Chuckanut Health Foundation and the Mount Baker Foundation, we're sponsoring slots for a Measurable Equity virtual conference that's happening November 13th and 17th, and several of you are going to be in attendance. You are all invited to attend, and I'm happy to pass on that information to those of you who are interested. And it's a free virtual conference, but what is really amazing about it is that way back in February, when we were trying to figure out how to bring everything we were learning from the Racial Equity Institute into this results-based accountability framework, we weren't seeing a lot of examples of communities that were doing that. And when I was saying earlier, this sort of the gift of the pause, is that now this conference is being hosted by PolicyLink and Clear Impact, who are, it's results-based accountability meets equity, sort of coming together to really teach our community how to measure the equity that's happening within our community using results-based accountability. So it's sort of this really amazing gift. It is lovely to always to be out in the forefront and be trying new things, but it's also not a bad thing to have a little bit of a roadmap. And and then the last part of this is that there continues to be opportunities to connect with the Child and Family Action Plan work, as well as the Racial Equity Commission, and all of the different initiatives that are have emerged, and the great work that's happening. Some of the challenges is, I think, like everyone else, there is a lot of COVID fatigue. As a team, the Healthy Whatcom team has had to reorganize a bit because of folks being pulled into different areas of work, having to, support children who are homeschooling, and different responsibilities at work or within their family structures. Within the health department, to do this work, we need staff to help with data and facilitation, and our staff are doing amazing work with our COVID response now. And then just, as I said, there is a lot of really great work happening, and yet it's not yet connected in a way that is, I would say, really robust, and in a way that really amplifies one another's good work. And so there's still definitely work to happen there, but as going into this year, what our plans are is going to be that after the Measurable Equity Conference, we are going to relaunch our planning. We're working with our funders right now to secure funding to facilitate our action planning efforts and our priority areas, and we're working with the Healthy Whatcom team to figure out sort of the sequencing and timing for those different initiatives, as well as trying to bring the pieces together. And so our goal and hope and intention is that we are going to be building our chip over the course of this year. It's going to take a little bit longer because we're no longer able to do it in a 1-2 day shot of getting all of our community partners in one room, because that doesn't work anymore. So instead it will be through virtual coaching and facilitation with clear impact, but that's what we're looking at doing over the course of the year. And I'm just very excited about the way that it's unfolding and some of the opportunities to bring all of this really great work together. And I know I just flew through a lot of information, but it is hard to get through a multi-year process in 10 minutes and leave time for questions. So I will now, I'm going to stop sharing my screen so that I can see you all. And if you have any questions, I would love to hear them.
I just want to say thank you so much, Amy, for sharing that. Yes, appreciate you.
Mutual.
You know, I think there's this momentum that's where all these different people are talking about children and families and about equity. I've been in Whatcom County for 21 years, and I've been in community mental health all that time. And it was frustrating to see how often, I've said this many times before, children and families are no better than third on anybody's list. And the idea that all these different kind of groups with Generations Forward and Healthy Whatcom and all these movements toward putting children and families first, that is something. And I've also said this before, COVID has made it clear that children and families are the most vulnerable people when it comes to things like this disaster. And this is the worst year ever in my entire life that I know of for families right now. And so now more than ever, children and families need to be first. And the idea of having something like an Office of Child and Family Wellbeing, where we get these kind of things are more than just simply embedded in a single department. They are at the forefront of all that Whatcom County does. And so I very much appreciate all the effort that you've put in and that Generations Forward has put in there, all that kind of hard work. That's where that momentum came from. So thank you.
Thank you.
I had one quick question when thinking about the racial equity lens, and specifically some of the data that is in the Healthy Whatcom website. Is there a way to get back into that data and disaggregate it by race, specifically with some of the chronic health diseases, and to be able to break that down a little more? I know that we have data on some of the education factors, and we have data on mortality. But for the other kind of health outcomes, I can't find data that's disaggregated by race, specifically with like cardiovascular disease and some of those other things that might not necessarily show up as overtly in some of the mortality issues, but can show up as impacts on quality of life.
Thanks, Steve. I think that, as mentioned, one of the challenges right now is that we don't have a lot of staff to pull into the data and really go back into it and look at it. And I know Amy Hockenberry is on the phone, and she and her team have been just, they are the ones who really pulled all of the data for the community health assessment. And they made it a top priority where possible to disaggregate by race and ethnicity or wherever we were seeing a disparity. So if we weren't seeing a disparity by race and ethnicity, then we looked at gender, or we looked at age, and we looked at income status as much as possible, and then that's what you're seeing. So a lot of the data that is in there has been disaggregated in the way that we can, but that was in 2018, and things are consistently changing. And so our ability, and Leah can actually speak to this pretty well for her role with Island, I'm sure, that our ability, I'm really excited for one of the things that we need to do to sort of relaunch our community health improvement effort is to do a bit of a data update, especially within our priority areas, because in order to do those turn the curve workshops, we need to have data that we are looking at to turn the curve on. And so we will have an opportunity soon to do a bit of a data update. And then in a normal community health improvement cycle, there is an annual update of data that happens. We just have not yet hit normal. With COVID, we kind of have had to pause things. So moving forward, that's one of our top priorities. I know it's a huge priority of Amy and Katie and their team to really dig in and disaggregate where possible. And I know that they spend a lot of time and attention to data integrity and making sure that they're working within the small number guidelines and things like that.
Yeah,
so
if I could.
There we go.
Yeah, if I can just jump in. Yeah, Steve, there is an opportunity to dig in more. And to Amy's point, we did disaggregate as much as possible and look at all ranges of disaggregated data. And then we put it through these sequences of criteria for what should move forward in consideration about what's happening in our community. And that's not to say that, to your point, it might not be the most alarming thing, but it does tell a story. So, and so the other thing that comes up for me is, so basically, I think the answer is yes, and we can continue, and would love to talk with you more specifically about what you're interested in. And then I know that my HIA team is working on the ability to provide kind of, it would be a parallel process to the update to our status assessment, but also provide as much data as is available now on the impacts of COVID, or COVID's impacts on social, behavioral issues within our community. So a benefit, and I'd hate to say it's a benefit, but an outcome of this situation of COVID is that a lot of researchers and agencies across the country have really ramped up their analysis and gathering of data since the beginning of the year, or since COVID hit. And so we're trying to gather as much of that information as possible. So it would be the most timely information within the last 6 months. So so a couple of different angles in which we're looking at how to provide meaningful information around the disparities of what's being impacted. But I'd love to hear more, and we're always welcome to all of the data questions, because that helps guide us where we head.
Go ahead, Greg.
Yeah, so I think you brought up the issue of small numbers, and another resource besides disaggregating our data, where it may be harder to find trends with the small numbers, would be to go to the state non-communicable disease epidemiology, and they'd be able to provide comparisons with other counties as well. And we could also be extrapolating based on the kind of the demographics of the county. Even if we don't have the direct measures, we might be able to get useful extrapolated numbers from that. So.
That's helpful. Thanks, Greg. I think if no one else has questions, oh, I see Astrid just unmuted.
Oh, no, I was just going to say that Amy mentioned the work around and the thinking around results-based accountability, and about 10 years ago, or maybe it's even longer, we began to integrate a results-based approach in the health department, and it's kind of slowly weaving its way into performance management in a number of different areas. But I think we talk at times about things that will transform our work. And it's thinking in a results-based way, I think is one of those key transformational things that we can do both as an agency and as a community. It sounds kind of jargony, results-based, what is that? But just thinking through the approach and the way of thinking it's so powerful. And so I encourage you all to look it up. And if you can attend the Measurable Equity Conference, I think there'll be an opportunity to learn a little bit more, not only about equity work, but also about the results-based thinking. It's embedded within the Child and Family Action Plan intentionally. So there's a bunch of trying to point to it, but having a background in results-based accountability, I think, will be very powerful for our community and to see the difference that we want to make. I mean, to actually see curves turning, make curves turn. Thank you.
I just had a quick question, Amy. With that conference, really excited about it. I do have a couple things for work that I would have to pop out of the meeting for, and so I'm just wondering if that's going to be more disruptive, if there's going to be sessions, and so just kind of wondering the dynamics. Is it better to be able to pop in or out, or I think I read that it was going to be taped or recorded?
Yeah, that's the nice thing about it, is that it's all going to be available for viewing afterwards. And so if you aren't able to attend during the specific sessions on the 13th and 17th, then you'll have up to 30 days after the conference to view all of the materials and reference things. I have attended 2 of the Policy Link Equity Summits so far, and then also did the Clear Impact training, and they were such high value. I couldn't believe how practical everything was. And I tend to just pull everything that they share onto a separate Google Drive and just keep it and reference it back, because it's just really awesome things to do. One of the things I think would be really interesting to this group in particular is that all conference participants are going to be given an equity scorecard, which is it's a data platform tool that Clear Impact uses. But I think what's going to be that you can use to measure the equity in your community, and they're going to give us sort of sample indicators that we should look at and that we should be measuring and paying attention to. And so I think that would be a really fabulous thing for this group to really noodle on. Are these the right measures for our community? Is this what we want to be looking at? And then how do we tie this to that resolution? And then the work of the Racial Equity Commission and the Community Health Improvement Plan, and just start to bring all of those pieces together. So I am, like I said, I'm really happy. And actually several of you are registered. We can do a show of hands of folks who are already planning to attend. Yeah, I know Sterling, Lindsay, Erica, Astrid, Steve, Gina, awesome. So, and I'm happy to send that invitation on. I guess I would send it to Samantha and she would send it out. Is that the way of things? All right. And I just had put the Healthy Whatcom website in the chat box, and that's the website that we are sort of using to put all of our reports and priorities and different pieces onto it. One of the other things that has been an impact of COVID is that we don't have as much communication support, and so the website still has great information, though it's not completely up to date with where we're at in our process. But you can still find the community health assessments, the report from our focus phase, where you can see how those priorities emerged and all of those good pieces.
Thank you, Amy. One last comment is what you and Astrid and Amy Huckenberg, okay, she's just on the, you guys, the work that you guys do is so huge, and you guys bring a framework to move our community forward with health and equity. So it's a huge body of work, and you guys have been relentless and amazing at it. So thank you. Okay, so the last thing on the agenda is brainstorm items for next year. So if you guys kind of go back to the last page on the agenda, there were some potential items for policy agenda. And these were things that we had discussed back 2019. And we're all just kind of trying to slowly pick up things pre-COVID. And so let's hear from you guys. So what do you think? There's no any specific person leading
Okay,
this.
I Les Seeley for the record. I went through this and I'm curious to what the condition of the health department is. Budget wise, what's going on there? And then I know I've heard rumors that there's a few retirements. So what is the condition of our health department? And then I think the next priority, unfortunately, is COVID. It's still with us. And then going through this, community childcare, we've challenged ourselves. That would be the next top priority. Followed by racism. That's right in our face and dealing with it. And I'm sad that we couldn't get the county council to move forward, but hopefully Steve and Leah can work some magic there. And then domestic violence and assault would be important. I mean, last month, didn't we have a murder suicide where two 7-year-olds were killed by their mom? I mean, it follows right into our domestic violence issues, and it's right here in our county that we have that. I'm fearful on the next last thing, gun violence. When we put gun in something, I think we're going to have trouble if we needed to go anywhere. If the county council will run into the same defensive wall that we ran into with racism, that I might consider changing that to weapon and link it into domestic violence, but not make it a top title line, because I fear we're just county council completely unanimously isn't there yet to do something with that. Climate change should be everybody's concern. One of the thoughts on that is that, and that might be out of the healthcare role really, but encourage, we're losing some businesses. What used to be Heath Techna and Intalco are going away, and this county supports and believes in climate change. I was curious if Sat Paul or Barry could meet with the Huxley College people and ask for the top 20 businesses in the world in climate change and do something to recruit them to come to Whatcom County to employ some people. I think that might, if nothing else, be a show that we care about climate change without much cost or effort. So I'm sorry to kind of go off on that, but that's what I went through this list and came up with. Thank you.
Thanks, Les. That's great. Anybody
Gina,
else?
would you like me to address the budget and organizational questions that Les asked? Okay, I can do that now. You are correct. We have 3 really significant retirements, and I'm looking at 2 of them right now. My dear colleagues, John Wolper is our environmental health manager, Greg Stern, our health officer, and Ann Deacon, our human services manager, all plan to retire within the next 6 to 8 months. And we have begun recruitment for both Ann's position and Greg's position, and plan in the early next year to begin recruitment for John's position as well. So that will be a major shift in our department. It's hard to even talk about because they're dear to all of us and have been a part of our health department for a long time and are doing just incredible work. And with regard to our budget, we have some knowns and lots of unknowns in terms of next year, not only from a county perspective. The county has actually fared better than we anticipated this year. The sales tax revenues were higher than were anticipated, so the impacts were less than we thought they would be. Next year, it's hard to know. There's a lot of really bad economic indicators, debt indicators, default indicators, you know, and when rent relief expires, et cetera, and utility relief expires, there's going to be, we're concerned about the community and what that will look like, not only for the county budget, but just in general. We have, as you all know, we have CARES Act dollars that are abundant and imminently ending. We don't know what or if the next federal relief package will look like, and if it will benefit our health department or our county. That's a big question mark, because the CARES Act dollars have really spread their tentacles in many, many helpful ways in our community, not just for the health department. So we are obviously hopeful. We're talking to our federal delegation about the need and the concerns about not having another federal relief package. But I'm sure that one of these days when the election is determined, there may be some more momentum to move forward and reach an agreement on that. We have received some state funding that is allowing us to continue some of our temporary positions, and we have heard that there may be another state package that comes to local health jurisdictions. But again, they have to balance their budget at a state, and their budget is challenged and distressed as well. So there's a lot of unknowns, and actually this afternoon, Kathleen Roy, my assistant director, and I are going over our budget with our council for 2021 and 2022. So there's a lot of unknowns, but I will certainly keep you all apprised of new monies, of changes, things like that. So we need more in order to be able to continue our good work. We just don't know what that's going to look like or where it's going to come from.
Thank you.
Anybody else?
One thing I was thinking, and it's not.
Go ahead, Steve. Go ahead, Steve. Yeah.
Okay. And I can't even wrap my head around specifically, like maybe this is just something a bunch of different programs are going to be doing. Maybe it's part of kind of a new community health assessment coming in. But I feel like in some ways we're very focused on, and understandably, on the now with COVID. But at some point there is kind of theoretically this post-COVID world where a lot of the health issues that have been kind of hiding suddenly come to reckoning. And I worry that in many ways we're not planning for that reckoning. You know, I mean, I even think when Les was talking about domestic violence and child abuse and things like that, all that's happening behind closed doors right now at a higher rate than it's ever happened before. And so, you know, you can even talk to like Whatcom and stuff like that, and they didn't have kids for like 4 months. And, you know, ironically, that's not a good thing. And so, you know, is there a way that we can start thinking about how we plan ahead to address some of these longer term consequences and really kind of pick our eyes up off the ground slightly and start looking at the horizon? And maybe that's just a universal philosophy more than something that's actually actionable, but I think it's something worth thinking about, and how the PHAB can get involved in that.
Thanks for that, Steve. There is a lot of, and Astrid is involved with this as well, and our strategic planning unit within the Whatcom Unified Command Structure is really thinking about what does recovery look like. in our community. And we're at the beginning stages of those conversations, but it's certainly on our minds.
And this isn't a disaster, like a typical disaster where you rebuild buildings and it's something that happened like a hurricane or an earthquake in a day or a few minutes. It's still going on. And like Steve said, and like in the same areas that Les talked about, it's those same things that are not happening. For me as a mental health specialist, I see these things that are happening at school. Unbelievable disaster for these vulnerable kids who were already disengaged from school, who are now completely disengaged from school. And remaining flexible in how we respond to this as it unfolds, especially this winter, whether or not there's a surge. I think we'll know a lot more about what kind of things are going to be really, this community, Whatcom County, is going to be struggling with for years after, and where PHAB really needs to be aware and flexible about how we're going to identify those things that our community needs to focus on. I'm clearly a kid and family person, and I'm going to definitely remind people about that. There are other things too, as long as kids and families are not hurt. There's this fall and this winter are really going to tell us a lot.
I even just think about things that have almost become kind of a joke in our experience, which, like people kind of talk about, we laugh at times about the increased alcohol consumption that's occurred, but it's become a long-term increase in alcohol consumption, which means people's behaviors around alcohol are changing. And people's relationships around drinking are changing. It's become habitual changes at this point that, even when people might get into a better emotional state, possibly in the future, that habit could continue. And how do we begin addressing things like that? Even kind of those little things that just seem to kind of lie under the water, but over the course of a few years can have pretty big consequences.
So I think for me, when I looked at this list, sorry, I thought, wow, that's like, those are a lot of really big issues and a lot of issues that, I really think the ability, like Sterling said, and Steve, to be flexible and to look kind of forward in this time. And also, I really think digging into quality instead of necessarily quantity. And we're seeing this year the amazing amount of work that goes in, or in the past few years, to the, health protection for immigrant families and what that took for the, children and families, for the racial equity work. And so just really looking at the quantity of work and the quality of work and how much we're able to really focus on the priorities. Yeah.
Thanks, Lindsay. That's actually really to the point. Leah, I think you were trying to say something as well. Okay. I think I kind of hear what people are saying, and what I'm hearing is all these things that we have on the list are really important things, but they're really, really big things. And with COVID looming sort of like a black cloud over all of us, I just wonder if we have room or the capacity to truly delve into it and try and make some true changes like these issues really deserve. But the things that like the work on race equity and training, well, not the training, but the work on equity, we've already kind of started. And so I feel like that we can continue on because it's work that we already have our hands on. And with the community health assessment plan, and the actions that Amy was talking about, that we have to do, because without a structural framework, you know, our work or the health department work or all of our work won't be as effective. So we need a vehicle to move it along, and Amy is building that vehicle. So I in like looking at the list, in my opinion, the first priority is the community health assessment plan and the moving forward with that. Using that as a vehicle, we use the race equity and the work that we're already kind of that is in the process, and make sure we put the quality work into it, like Lindsay says. And so I totally think it's not a climate change, but climate crisis. I absolutely agree with Les about domestic violence, especially during this type of people's suffering from COVID behind the curtains, and I believe all of that. But if we actually do it in a structural, systematic way, we can actually be more effective and address these things. So that's kind of how I see it. This is not a voting situation, but I feel like that makes more sense. That makes the more sense to me anyway.
Yeah, one thing I think of is like, where can we be the most effective and move the needle the most and have the most community impact? And I could be wrong on this. Like, I feel like when I try to think about the power that and the effectiveness that PHAB has around climate change, even with the county council, I also think that there's a lot of organizations in Whatcom that are effective at that already. And I would need to see what we have that's value added in that situation that moves the needle the most. Whereas with domestic violence, child health, things like that, that's where I think we can move the needle more and get more productive impacts and things moving forward. It's not that one is more important than the other. It's that I think we're more well positioned with one than we are the other. And so thinking about, you know, I don't want to repeat the efforts or just build on, you know, build a new road next to a road that's already working. And to people's points, I feel like a lot of Whatcom County is very focused on climate change right now. And so I would, in order to prioritize that, I would need to know what we would be adding that would be effective. But I do feel like with some of the other more kind of overt acute health issues, that we are much more effective at that.
Thanks, Steve. That makes sense.
I would support anything. Oh, I'd support anything that moves the needle forward.
Go ahead, Esther.
I was just going to point folks to the North Sound Accountable Community of Health. Our partners, our regional partners, have been looking at a recovery. I guess it's, Amy, maybe you could describe it a little better, but a framework called Thriving Together. It's about using this moment in time as kind of as a lever to move in a different direction. So it's the Thriving Together Springboard. It's a national effort, and it might just be it's just a helpful frame that you might be interested in looking at that could inform some of the work that PHAB does. It's definitely informing some of the work that our regional Accountable Community of Health is using. So just a resource.
Could you send that link to us, Astrid?
Sure.
Thanks.
Yes. And Amy, maybe you
Astrid,
can.
I can attach it when I send. I'll attach an email I send to Samantha that also has a measurable equity invite.
Perfect. Thank you.
Thank you. So, any further discussion on our priorities for next year? Okay, perfect. So we're about to close the meeting, but I'd like to hear from everyone about what you felt was good or we could improve on the meeting today. Sterling?
It was I think all the public health advisory meetings that I've ever been to have been amazing. And I even got to get up an hour later because it's 8 o'clock. It was 8 o'clock here when I started, which I was very happy with. We've accomplished so much this past year and a half. Things that like moving the needle, that Child and Family Action Plan is something that I truly think could move the needle at least a little. And the idea of having things to measure, like Amy talked about, childhood readiness for school, that's a measure. And so, we just need to keep that momentum going. We have a lot of committed members in this group and hardworking people, and so I'm proud to be part of this group.
Thank you. Thanks, Sterling. Amy? Oh, okay. John? Comments about the meeting?
Yeah, I'd just say that I'm always impressed listening to the details of everything that's going on and how everything is really, truly interconnected in the work that everybody's doing. Erica mentioned that there's a few of us who are going to retire. And again, while I'm looking forward to it, it's amazing to see all the good work that's going on. And so when I do finally pull the trigger, it's nice to know that the individuals who are still here will be carrying on all the really tough things that need to be taken care of. So, for me, again, I think the meeting went fantastic. I always learn something in it, and I just really appreciate everybody.
Thanks, John. Erica?
I want to echo the previous comments. And, one of the things that you all did this year and you led on was that employer support task force. And I credit that when we talk about tangible results, I credit that partnership with a lot of the results that we're seeing in our case counts, because employers feel supported. They have the information they need. We're not seeing big outbreaks at most employers. It's 1 or 2 cases and they're controlling it. And because of your work, I think we were better positioned to control the spread of this virus in our business setting. So that's I think there's a lot to celebrate this year, despite how hard it's been. And I just wanted to share that, but also just looking forward to thinking through these big challenges with you next year. And I'm just grateful that we have the membership we do that is supportive and smart and ready to take on some really tricky things that we know we can make a difference in health. So thanks for that.
Thanks,
just grateful
Erica.
for you.
Thanks. Les?
To kind of echo Sterling, I'm proud and humbled to be part of this group. When I initially came on, it didn't seem like we were doing much, but between Rachel's leadership and Chena, your leadership this year, and Erica stepping in, it's proud to be part of this group. And I think we're making a difference in this community, and we're going to continue. So thank you to everybody.
Thanks, Les. Lindsay?
Yeah, I think that I really appreciate when we're able to hear, and just kind of be recentered again by folks from the health department and the work that's going on the ground and how we can connect to that. So I appreciate Amy coming by and Astrid being here to talk about that, and then Amy Hockenberry on the phone for all of the data work. And then I just think, any way that we can support, like I'm thinking of Steve and Leah going into this meeting. And so any way that we can support each other in this, this work. And I'm feeling like I just want to, wrap my arms around you guys. So virtual arm wrapping.
Thanks, Lindsay. Steve?
Yeah, I thought the meeting went well today. It was nice to hear a bit more on the community health assessment and the plans and path forward. I think that that's going to be really important. I'm excited for more data coming in, because I think that that will also focus the PHAB. I think that we can think about problems, but I think that when we have the data to actually see what's going on, then that can really focus us and guide us a bit more. And so I think that that's going to be really good, as well as the continuing partnerships. And the only thing that went wrong with my meeting today is that for the first 20 minutes, I was trying to get my children dressed.
I knew it. I knew it.
So the two of them were my challenge this morning, but that's all fine now. And so I also just appreciate the support from everyone in the PHAB and from the health department. I have a tendency to spin out on things, and so it's nice to know that there's a group of people who are on your side supporting you and like-minded and trying to make sure that things are as effective as possible. Yeah. And that's especially, I think, going to be needed over the next 2 to 3 weeks.
Yep. Well, just so know that you and Leah have our support all the way. Astrid.
There it is. Yeah, I just echo just the last bit here with Lindsay and Steve. I really appreciate this as a place to connect with each other. There's a lot of issues to deal with, but I feel like over time and having worked together now that there is a sense of team here, and that comes out in these meetings more and more. And so I just really appreciate that. Appreciate all of you as part of the team, and appreciate you as a team.
Amy, can you unmute? Or are you still muted? Okay.
I don't know what was happening there. I think I was probably putting it too repeatedly. But I think that it's lovely to start the day with you all. I just think this is I think the third meeting in a row that I've sat in on, and I think there's just been such a uplifting of energy and progress. And as I said before, I really appreciate the leadership that's coming out of this group, and I'm feeling a strong connection between the work that I'm doing on the ground and this group, which is just the best feeling in the world. Because I think a lot of times when I would show up, people would be like, "You're doing what? And who are you?" And I feel like we are all really grounded in the work that's happening in the community. I think as a community member, it's also really relieving to hear the conversations that you all are having around priorities and the long-term impacts and some of the other hidden pieces that are happening in our communities. We talk about COVID and just being really meaningful in thinking through your role and where you have the best kind of lever to pull. So I'm just really appreciative of this group and really thankful for the conversations that you're having and the work that you're doing. So thank you.
Well, thanks, Amy. What I have to say is I'm just amazed by all of you. I'm grateful and thankful to all the PHAB members. You guys have shown up and been supportive and been the pillars and the strength through a lot of these work. And of course, without Erica and Astrid and John, the health department, none of this would happen. And you guys just work amazing, just relentless champions, warriors in this cause. And so I want to thank everyone. I do have to say one criticism of the meeting was that there were 3 meeting minutes that we needed to approve that anyway, I apologize for that. But otherwise, I think the meeting went great. Thanks for showing up, and until next time. And Steve and Leah, please let us know whatever support you need in the next couple of weeks. And I am calling the meeting to an end.